Good morning and welcome to this AARP telephone town hall in partnership with the Healthier Black Elders Center at Wayne State University. The Healthier Black Elders Center's goal is to target and reduce health disparities through research and education. Today, we will discuss the importance of getting a flu vaccine during the COVID-19 pandemic. I am Brenda Price, Associate State Director for AARP Michigan. Thank you for joining us this morning. I am pleased to announce that I am joined today by two medical experts who will offer medical advice on why it is important to your health and the health of your family to consider the flu vaccine during this time of COVID-19. They will also answer your questions. We hope this information provides you with useful background information on how to best access vaccinations. You should always consult your physician to determine the best course of medical action for you personally. This is an interactive call, so we're looking forward to hearing from you with your questions. If you'd like to ask a question at any time during the call, you can press *3 on your telephone keypad to be connected to an AARP staff person. They will take your name, city, and your question. They will put you in the queue to ask your question live to the doctors today. As a nonprofit, nonpartisan social mission organization, AARP strives to connect you with resources and information on issues that matter to you and your family. We are discussing this issue because it is important to live a healthy life as we age, and because getting a flu vaccine during the pandemic raises issues of safety and other concerns to our members in Michigan and across the country. Again, if you have just joined us, my name is Brenda Price. I am the Associate State Director for AARP Michigan. This is an interactive call, so if you'd like to ask a question of our experts, you can press *3 on your telephone keypad at any time to be connected to an AARP staff person who will take your name, your city, and your question. Now, I'd like to introduce our two guests on today's call. Dr. Teena Chopra, Professor of Infectious Diseases at Wayne State University, and Dr. Jennifer Edwards-Johnson, Family Physician in Lansing, Michigan, and Community Assistant Dean for Michigan State University College of Human Medicine, Flint campus. Before we get started with questions for the doctors, I'd like each of you to share what you hope people on this call will come away with from this discussion. So let's start with Dr. Chopra. Please share with us.
Thank you, Brenda, for having me, and thank you all for joining us today. As Brenda mentioned, my specialty is infectious diseases, and I'm also the hospital epidemiologist at the Detroit Medical Center. And I would like to highlight the importance of flu vaccination today, and also be able to explain the similarities and differences between flu and COVID-19. As you know, they are both different viruses. So with that background, I would like to highlight the key differences between flu and COVID. The fact that COVID seems to spread much more easily than flu and cause more serious illness is extremely critical for all of us to understand. And also the fact that it can take longer before people show symptoms and people can be contagious for longer with COVID. And another important difference being that there is a vaccine to protect against flu, but there is no vaccine available currently to prevent COVID-19. So the best way to prevent infection is to avoid being exposed to the virus. I would like to stop here and Brenda, over to you.
Thank you. Dr. Edwards, can you share with us what you hope people will get out of this call?
Yes, thank you so much. I'm Brenda, and thank you, Dr. Chopra. Thank you, all of you, for attending. I really hope that you all walk away with an understanding of best practices to keep yourself and your loved ones safe, an idea of where to access resources, of where to get vaccinations, when and where you can get vaccinations, and to walk away confident on how to protect yourself and not be fearful and fearful of the unknown, and to really kind of feel confident in the resources that you're able to access.
Thank you. Now we'll ask a couple of questions. Dr. Chopra, you did mention it in your opening comments, but just in case you want to reinforce it, how is COVID-19 different from the seasonal flu virus?
Sure. Thanks, Brenda. So, just because some of the symptoms of flu and COVID are very similar, it may be hard to tell the difference between them based on symptoms alone. So, testing is necessary to confirm a diagnosis. A lot of the characteristics of presentation of flu and COVID are very similar, but there are some differences. Like COVID can also, in addition to fever, headaches, body aches, can also have present with loss of taste and loss of smell. So those are important differences in manifestations. And other differences in the virus per se is that COVID-19 causes much more severe disease, and not only infects the lungs, but more like a systemic illness. It can affect pretty much any part of the body. Also, the other thing is COVID-19 is more contagious. It can take longer for people to show symptoms with COVID-19, and people can be contagious for a longer period of time. Another important difference is the lack of vaccine for COVID-19. There is no vaccine to prevent COVID-19 at this point, and the best way to protect ourselves is basically washing hands, masking ourselves, and remaining 6 feet away from each other and not congregating in closed spaces. So those are important differences. We do currently have a vaccine, which is for flu, and protecting ourselves from flu is extremely important because flu and COVID can present at the same time. And when they are presenting together, complications can be more severe. So if you're protected against flu, it makes makes things easier down the road. So those are the important differences that I would like to highlight.
Thank you. Why should someone over the age of 50 consider obtaining a flu shot?
Sure. As we get older, we do not have the same immune response that we have when we are younger. With age, there is a phenomenon called immunosenescence. We do not mount the same antibody response, and we need to make sure that we are well protected because older adults are known to have more complications from respiratory viruses like flu and COVID. We have seen that in the literature, and whereas a younger person may have milder illness and may overcome it with time, but older person, more than 50 years of age, must get the flu vaccine. Even if they are exposed to the flu virus, they will get a milder illness if they have received the flu vaccine in advance. Also, older adults tend to have more comorbid illnesses, and that can put them at higher risk of complications of flu. Every year, we see high numbers of mortality from flu, particularly in our older population. Hence, a flu vaccine is one way of protecting ourselves.
Okay. I'm going to ask Dr. Jennifer Edwards-Johnson a couple of questions. Dr. Edwards-Johnson, should older people continue seeing their doctor for regular medical appointments during COVID-19?
Thanks, Brenda. The answer here is an emphatic yes. It's some of what Dr. Chopra alluded to with higher risk populations who are older, populations who are dealing with comorbid medical conditions are at higher risk for both COVID and for flu. So if you are able to get into the office and make sure that you are managing any medical conditions that you have, make sure that those conditions are stable, make sure that you're getting your medications for those conditions and that they're being appropriately treated, then you put yourself in the best situation to be able to combat flu or COVID in the unlikely event that you contract flu or COVID.
Okay, I have one more question. What should older people do before, during, and after seeing a healthcare provider in person for a medical appointment?
Yes, I think this is an excellent question. I firmly always telling my own patients, call the office, inquire about the opportunity for telehealth visits or video visits. In the event that you're not able to get into the office and you do want to do that sort of checking in on your chronic medical conditions, always call the office. Also call the office to inquire about the availability of vaccines. They may be out of vaccines, they may direct you to a different location. Always good to call the office regarding those items. I also suggest that you make sure that you're kind of doing an inventory of any medications that you take. Inquire about office practices for safety. What is the office doing to keep people safe? Is everyone in the office wearing a mask? Are there cleaning procedures in place? And all of those things can be done prior to the visit. During the visit, most of our visits have been taking place as standard. Everyone in our office, for example, wears a mask, and we ask that every patient wears a mask as well, covering their nose and mouth. Whenever you're in the office, staying as distant from people as you can. And a lot of offices generally have practices in place to ensure that you're able to be at least 6 feet away from anyone else who might be in the office. And then the biggest thing is wash your hands, wash your hands, wash your hands. If you don't remember when the last time you washed your hands was, you should wash your hands again. And I think these types of practices really help decrease the possible transmission of flu and or COVID.
Wow, that was a good tip. If you don't remember the last time you washed your hands, you need to wash your hands. That was really good. I like that. So I just want to remind our audience that if you'd like to ask a question at any time during this call, you can press *3 on your telephone keypad to be connected to an AARP staff person. *3. That person will take your name, your city, and your question and put you in the queue for your question to be asked live today. And with that said, we are going to advance to some questions that we have coming in. So I would like to start with Patricia from Muskegon. Patricia, would you like to ask your question live?
Yes. I had heard that the vaccine for flu had caused a lot of deaths that was never really being reported. And I want to know what's that true.
Okay, thank you for your question. I'm going to put you back on hold so you can hear the answer from the doctors. Thank you very much for calling and asking your question. Would Dr. Chopra like to answer that?
Sure. So thank you, Patricia, for your question. Flu vaccine is extremely safe, and it has been around for a very long time, and there's a lot of research that has been done around the flu safety and efficacy of flu vaccine. And every year when the flu vaccination is manufactured, there is a lot of safety efficacy studies that are done around it. So this is a myth that flu vaccine can cause harm. When we get the only reactions that some people get to flu vaccine is the actual shot at the site of injection can cause pain and tenderness for a few hours after getting the vaccine. But other than that, flu vaccine is extremely safe, and it protects your body and prevents you from having severe complications from flu, including death. So it is a very safe and protective vaccine.
Thank you. The next question, Dr. Edwards, I'm going to share it with you. We are taking a call from Debbie Daldine from Kimball. Debbie, would you like to ask your question live? Debbie, are you there? Well, Debbie's question was, if I was sick after my flu shot last year, how long should I wait to get another? Dr. Edwards, can you answer that for us, please?
I would say that if you were sick after the flu shot last year, there's no reason this year that there's any reason you need to wait to get the flu shot. The flu shot, as Dr. Chopra described, is very safe, very low rate of complications, and is different from year to year. And I would recommend that as soon as you are able, that you would get a flu shot and have that discussion with your primary care physician, but definitely reaching out to them to get the flu shot as soon as you can this year.
Okay, great. Dr. Edwards-Johnson, I have another question for you. We're going to take a call from Terry in Essexville. Terry, would you like to ask your question?
Yes, I would. Doctor, I went to my 6-month checkup with my regular doctor, and I asked about a flu shot, and they said they hadn't received them. So they put me on a list for them. I'm 72 years old. On the way home, I passed by a Walgreens in Essexville, and there was a sign saying they had flu shots. So I went in and walked up to the pharmacist, and I said, I'd like to get a flu shot. And he looked at me and he said, a person of your age, we're out of that particular flu shot, but we can give you the regular flu shot. So my question is, what's the difference between the two?
Hi, Terry. Thank you so much for your question. There have been certain high-risk populations, people over 65, people with comorbid medical conditions, who have been identified as. Can you hear me?
Yeah,
yes.
But not very well.
Terry, I'm going to put you on hold so you can hear, and hopefully you'll be able to hear better. Okay, Dr. Edwards, if you can respond, he may be able to hear better now.
Okay. There are certain high-risk populations that have been identified as benefiting from a higher dose flu vaccine. So there are 2 vaccines that we give. There's a high-dose vaccine that we give to higher-risk populations, and that has been identified as groups over 65 or those that have comorbid medical conditions or chronic medical conditions. And so certainly in our office and in many offices, they offer those 2 vaccines. And it sounds like they were out of it where you were. But the difference between the two is just that one is higher dose for people who might be at higher risk for complications related to the flu.
Dr. Edwards-Johnson, this is a similar question, so if you can respond to Suzanne from Niles. Suzanne, would you like to ask your question?
Yes, thank you for taking my call. I approached my pharmacist and wanted a flu shot, and they told me that they were out of the ones for my age, which is 77, and they talked me into another flu shot, stating that it might have more antibodies for my immune system because I'm a diabetic. Should I have waited for the one for my age, or should I have gone ahead and take the one that they had on hand?
Dr. Edwards?
Hi.
And
yes. Hi, thank you so much for your question. I'm sorry I missed your name. Certainly it can be difficult if they're out of the flu shot, and a lot of times the decision is based on whether there is availability of the higher dose flu shot or whether we are concerned about the potential risk that you may not receive any sort of protection against the flu at all. So I would certainly suggest that if you are able to get the high dose vaccine and you are someone who falls into that population of high risk, that getting the high dose vaccine, if you are able, is beneficial. But I think if you are unable to get the high dose vaccine, I agree with the idea that some coverage is better than no coverage. So getting the vaccine that is available should, your location or where you are be completely out of high dose options, then we have certainly given the regular flu shot in that instance.
Thank you. As a reminder, if you would like to ask a question of the doctors at any time during this call, you can press *3 on your telephone keypad to be connected to an AARP staff person. That person will take your name, your city, and your question. Again, that's *3. Dr. Chopra, I have a few more questions here that may be of interest to you to respond to. We are going to take live Roger Duncombe from Hartford. Roger, would you like to ask your question?
Yes, ma'am, I would. Thank you for taking my call. I'm 88 years old, and I got my high-dose flu shot in the middle of September because they said it would take up to 2 weeks to be active. Now, if the flu season is later or runs later, how long is this flu shot good for? And if it's not good for the length of the flu season, can I get a booster?
Okay, Roger, are you finished?
Yes, that's it. Thank you.
Thank you. Dr. Chopra.
Yes. Hi, Roger. Thank you for your question. As per CDC, you can get the flu shot as soon as the season starts, and the effect of the vaccine will last for the entire year. There is no evidence to get a booster, so you should be all good at this point for this flu season. You will need a vaccine next flu season again.
Thank you. Dr. Chopra, we have a new question coming in here from Daniel Hagan. Daniel is from Three Rivers. Daniel, would you like to ask your question live?
Yeah.
Oh, it's Julie. I'm sorry.
Yes.
Julie.
Dan's my significant other.
Okay. Go ahead and ask your question.
Okay, I'm a 59-year-old female who has had MS for over 30 years. I'm wondering if the higher dose flu shot would be better for me.
Thank you. Dr. Chopra, or can you answer that? I'm going to put Julie back in the hopper so she can hear.
Sure. Thank you, Julie, for your question. At this point, what CDC recommends is the high-dose flu vaccination for older adults. That is the only recommendation that they give. So you could, with your age, you could just get the regular vaccine at this point. You would not need the seasonal vaccine that is recommended for more than 65 years of age. That's the only recommendation that CDC has given at this point. And the reason being that this high-dose quadrivalent vaccine is studied in older adults at this point, and basically it mounts up 4 times. It has 4 times the antigen, and hence mounts a higher immune response in older adults. Since it's only studied in older adults, I would say that we would only recommend it in those patients.
Great, thank you. Dr. Edwards Johnson, I have a call coming in from Diane from Grand Rapids. Diane, would you like to ask your question?
Yes, I'm a 69-year-old who has dealt with upper respiratory issues in the past. And since the COVID, it's escalated. I've been on and off of antibiotics, which I feel like is just putting a Band-Aid on the situation. But am I dealing with a weak immune system and it makes me more susceptible to the virus? And what can I do about it?
Hi, Diane. Thank you so much for your question. Certainly, there are things that we can do to strengthen our immune system to make sure that we are able to fight viruses that we encounter every day, getting good sleep, exercise, eating a good diet. It sounds like you've suffered from some recurrent respiratory illnesses, and I think discussing that in detail, strategies that you can use to strengthen your immune system and consider how you can kind of combat these respiratory infections that you're encountering would be a really great step. I think the biggest thing is to make sure that we're doing everyday practices that Dr. Chopra's alluded to give ourselves, keep our immune system healthy, make sure we're taking the flu vaccine, make sure that we are washing our hands, make sure we're getting good sleep, and making sure that we're eating and exercising to make sure our immune system is able to kind of combat those things, those viruses when we see them.
Thank you. Dr. Edwards Johnson, I have another call that I'd like for you to address. We are going to take live Stanley from Livonia. Stanley, would you please like to ask your question?
Hi, good morning. Sure. My question is that I'm 65 or soon to be 65. I had basically survived the virus back in March, late March, early April. So my question is getting a flu shot, you know, typically we end up having sometimes people have little symptoms or something like this and accepting the flu, the vaccine. So will I experience basically the same stuff, even though I've had the COVID, that, or will I might have a little more severe reaction to it, or what? Thank you.
Thank you, Stanley. So the flu vaccine generally is very low risk of side effects, very safe vaccine. Certainly here and there we might experience very mild symptoms, if any. I wouldn't expect at all that they would approach or approximate anything like what we've seen with people who've been affected by COVID, or even people who actually have the flu. So the risks or the symptoms associated even with the flu vaccine tend to be very, very mild, if any, and generally we don't see many symptoms or side effects.
Thank you. Dr. Chopra, I have a call live from Barbara in Detroit. Barbara, would you like to ask your question?
If you've had a flu shot, is it, do you take another one?
Hi, Barbara.
Hi. Did you hear my question?
Yes,
thank
Barbara.
you. Dr. Chopra?
Yes. Hi, Barbara. Thank you for your question. You do get the flu shot every year. So if you've had it last year, you will need it again this year. So to answer your question, you need a flu vaccine every year. It's an annual vaccine. And the reason is that the flu viruses, they mutate and they change. So a new vaccine comes out every year. So you will need a flu vaccine now for this year.
Thank you. At this time, we would like to poll our audience. We want to hear from you. So we're going to take this quick poll. The question that we want you to answer is, have you taken the flu vaccine already this season? Press 1 on your phone if the answer is yes. Press 2 on your phone if the answer is no. And I will repeat. The question is,
your response has been registered.
Flu vaccine already this season. Press 1 on your phone for yes and press 2 for no. Thank you for participating in our poll. We will give you the results shortly. Now we'd like to go back to taking questions live. As a reminder, if you'd like to ask a question during your call, press *3 on your phone, on your keypad, and an AARP staff person will answer. That person will take your name and your question and the city in which you reside. At this time, we are going to take another question. And Dr. Edwards Johnson, if you could respond to this question from Sandra in Ann Arbor. Sandra, would you like to ask your question live?
Yes, thank you. I did have a flu shot in September, but prior to September 2020, I had one in 2019. But I don't usually take a flu shot, so I had not really had a flu shot in the last 20, 30 years. But this year, I experienced some muscular aches and pain, and my body was really sore. Now, not having a lot of experience with taking the flu shot, I don't know if this is typical side effects or, reactions, or, so I'm asking that question. And the second part of that is I hear a lot with building up your immune system with taking vitamin D. Is that recommended?
Thank you.
Hi, Sandra. Thank you so much for your question. Some light aches and muscle aches
Can be associated after having received the flu shot. So that could potentially have been something that happened to you after taking the flu shot. Again, those symptoms are usually very mild, and we don't see them very often, but certainly that is one of the reported kind of symptoms that can happen after taking the flu shot. With respect to your second question, making sure that you have adequate vitamin D is certainly an important part of ensuring your immune health. And so I would definitely recommend that you are working in concert with your primary care physician to have your vitamin D levels checked and make sure that you are receiving adequate supplementation should those levels be low.
Thank you. I'm going to share the response to the poll now. The question was, have you taken the flu vaccine already this season? 45% of you said yes, you've taken the flu vaccine. 56% of you said no, you have not taken it. We're going to go back to our live questions. Again, if you want to call in a question, please just hit *3 on your phone. We have a question from Gloria in Kalamazoo. Dr. Edwards Johnson, I'm going to share this question with you. Gloria, would you like to ask your question live?
Yes, please. I am 75. I have had one flu shot way back in probably my teens, early teens. I had a very severe reaction to it and ended up in the hospital. I have an allergy to eggs. My question is have they ever thought about making a flu shot, or do they make a flu shot that does not contain eggs?
Dr. Johnson, you got an answer for that?
Yes, thank you. There is a flu vaccine without eggs, and I think this is why in the early kind of comments I was talking about, certainly checking in with your office, because the availability may not exist at your particular office or in your particular drugstore, and so certainly checking to see where that availability exists. But this is actually a good question for Dr. Chopra. I think there might be 2 or more vaccines that are available that aren't prepared with egg products. But as infectious disease, she may have some more cutting edge knowledge than I do.
Dr. Chopra, you want to weigh in on that question?
Sure, yes. Like Dr. Edwards mentioned, there is a flu vaccine that doesn't contain eggs and is recommended, can be given for those who are egg allergic. And you always want to check with your physician that who is going to give you the vaccine. You must check with them before you get the vaccine that is most appropriate for you.
Thank you. We have another question from Phyllis And I'm going to see if Dr. Chopra can continue to answer questions here. Phyllis, you are live. Would you like to ask your question?
Yes, I would. Thank you very much. My husband and I live in a remote place in rural Upper Peninsula, and we've been very careful because of the COVID-19. We don't have any contact with people except outside and with masks on. We are doing all of our shopping by drop-off, curbside drop-off. And so my question is, will we be exposed to the flu if we're being careful not to be exposed to COVID-19, and therefore is it necessary for us to be vaccinated?
Thank you. Dr. Chopra, would you like to answer that?
Sure, that's a great question. You know, you never know when you could be exposed and how you could be exposed to flu. So my recommendation to you is the fact that this vaccine is so harmless that you should get vaccinated, because again, for all the reasons we talked about, that how complications will be much milder if you have the flu vaccine. But again, based on the southern hemisphere in Australia, where the flu season is already over, they had a milder flu season just because people were being very, very careful. They were masking, and masks not only protect you against COVID, but also against flu. So masks act as a good vaccine at this point for us. Having said that, they also in Australian experience was also seen that the population in Australia, individuals did get vaccinated against flu, and 60% of Australian population got vaccinated against flu, which is why they had a milder flu season. So I would say keep doing what you're doing to protect yourself against COVID, but also add the flu vaccine to your toolbox.
Thank you very much. Dr. Edwards-Johnson, this next question is for you. This question is from Lenoria in Inkster. Lenoria, would you like to ask your question live?
Yes. I've got the flu shot a couple of years ago, and I developed SIRVA, which they consider shoulder injury related to the vaccine administration. I ended with a frozen shoulder and a torn ligament. I still have problems with my shoulder. I've gotten conflicting information about whether I should get a vaccination again or not. What do you think, or what do you recommend?
Thank you for calling, Honoria. Dr. Edwards-Johnson.
Yes, I thank you so much for your question, and I'm actually going to defer a little bit to Dr. Chopra here again, as kind of the infectious disease expert, and let her weigh in.
Yeah, Gloria, I think that, first of all, I'm sorry to hear that you had a reaction and you had the complication that you have mentioned is very most likely from not the actual content of the vaccine, but how the vaccine was administered, and the fact that you had a local site reaction where you had pain and tenderness which progressed to a severe shoulder injury from it. The likelihood that it will happen again is low, because again, because of the fact that it's not the content of the vaccine that caused you the reaction. So I would discuss the risks and benefits with your primary care physician, and I would try to get the vaccine on a different site. And still, I would inspire you and encourage you to get the vaccine because the benefits are much greater. And this was a standalone reaction that I think was from the local injection site.
Thank you, Dr. Chopra. We have another call. If you can take this upcoming call. This call is from Brenda from Redford. Brenda, would you like to ask your question live?
Yes, I would. Good morning. My question is, I had the flu vaccine last December. I took very ill. I stayed in bed almost a month. Also, I have numerous allergies that I'm allergic to, foods and trees and grass and so forth. Some people said maybe the shot was something else. Maybe I had the flu already or something, but I had no temperature or anything. I was just wondering about the flu vaccine again.
Yeah,
Thank you for your call.
Thank you, Brenda, for your question. I think that there are certain myths about the flu vaccine that we should all be aware of. Like I mentioned before, flu can cause serious complications in adults more than 65 years of age, in adults with chronic conditions like asthma, heart disease, stroke, diabetes, chronic kidney disease, and other special high-risk groups, also including very young children, pregnant women, people who have HIV, cancer. So all of these are very high-risk groups. And it's extremely important that we protect us against ourselves against flu, because we don't want additional complications from flu. The reaction that you mentioned is not necessarily from getting the flu vaccine. Like I said before, flu vaccine causes local site reactions or maybe a day of fatigue or feeling low. But other than that, flu vaccines are very efficacious and very, very safe, and they are recommended by CDC for everyone 6 months of age or older.
Great, thank you. Dr. Chopra, I'm going to share this next live call with you. This is Teddy from Detroit. Teddy, would you like to ask your question?
Yes, I would. Thank you very much. I'm concerned that there are people that I know who are afraid of a needle and therefore avoid getting their flu vaccines or any shots. And I was wondering whether there was a micro needle or anything smaller than a usual needle. And also, I was wondering whether there was another delivery system other than having the flu vaccine administered through a needle.
Thank you.
Yes, so thank you for your question. The injectable flu vaccines that we have currently available, they have very thin needles, and I can understand how some people can have fear of needles, but now we have some very, very good needles which are very, very thin, and they are no longer as painful as they used to be in the past. The other thing that we also know of at this point, we have a flu mist, which is a nasal spray vaccine, which is also a quadrivalent vaccine, which means that it is made using the 4 different kinds of viruses that are most common during the flu season. So those can also be an option depending on your risk factors. That can also be given. Usually, nasal spray flu vaccination is recommended and approved in healthy, non-pregnant individuals from anywhere from 2 years to 49 years of age and older. But there are people who have certain medical conditions who should not receive the nasal spray flu vaccine. So, for example, children who are less than 2 years of age, adults who are 50 years and older should not get it. Also, people who have severe allergic reactions to any ingredient of the vaccine or a previous dose of the vaccine should not get the nasal vaccine. Then those children between 2 to 17 years of age who have received aspirin should not get the nasal vaccine. Anybody with weakened immune system, because this is a live vaccine, people who care for very severely immunocompromised people should not get it. Then other people who cannot get it are pregnant people who have other, asthenia or immunocompromising conditions should not get the live nasal vaccine.
Thank you.
If I can add, the only other thing I'll say is that highlights the importance of making sure you're calling your office or calling whatever location that you're going to determine kind of what they have available. Because For example, we don't stock the nasal vaccine, the live attenuated vaccine that Dr. Chopra is describing, in part because of those risk factors that we need to consider prior to administering.
Thank you. Dr. Edwards Johnson, we have another call. If you could take this call from Carrie in Auburn Hills. Carrie, would you like to ask your question?
Yes. I'm Carrie Ann Adams, 80 years old, cancer survivor, 3 years. I had the high dose flu shot, and I would like to know what is the name of that shot, and do they keep records of it? And I wouldn't know what to tell my primary physician about it. So I would like to know what is the name of that shot, and how do I know that I got what I thought I got? And do they keep records on it?
Thank you for asking. I'm going to put you back so that you can hear the doctor's response. Thank you.
Hi, thank you so much for your question. So in the most common name of the high dose flu shot is Fluzone. Dr. Chopra may know if there's another kind of manufacturer of the vaccine, but the one we have in our office is Fluzone. And we do keep, and every healthcare provider should be keeping very kind of detailed records of the vaccines that you've received. And so I think you are safe to say, I'd like the high dose flu vaccine or the flu vaccine for those who are over age 65, if that's the flu vaccine that you're wanting to make sure that you've gotten. And yes, they do keep records of your vaccination status.
Thank you. At this time, we have one last poll question. We would like to know if this conversation today persuaded you to take a flu vaccine if you have not taken one as of today. So if you have been persuaded to take a flu vaccine as a result of this conversation, please press 1 for yes and 2 for no on your phone. Again, I'll repeat the question. Has this conversation today persuaded you to take a flu vaccine if you had not taken one as of today? Press 1 for yes on your phone, press 2 for no. Thank you. And we'll go on to another question. If Dr. Edwards Johnson, if you could also take this question from Ms. Evelyn Gunter in Detroit. Ms. Gunter, will you please ask your question?
Thank you very much. I'm very interested to know what the doctor has to say. I am 88 years old, and the last time I took a flu shot was 3 years ago. And the reason I have not taken it since then was when I took the shot, I became very ill for a week, to the point where I was really wondering if people felt like this when they were getting ready to die. I had no energy, and I just felt very, very ill. In a week's time, all of that passed, but it was enough to frighten me so that I didn't really want to take the shot again. I feel compelled to do it now, but I needed to have some encouragement. I take vitamin C, vitamin D, and vitamin E every day. That's part of my regular routine.
Thank you. We'll let the doctor.
Thank you, Evelyn. I'm sorry to hear that you
had such a difficult time, and it sounds like you weren't feeling well at all. And
that's terrible. I will say it is important that
whenever you're feeling very poorly after any sort of medical intervention, a vaccine included, that you should be having that conversation with your physician to be clear on the circumstances. You know, what happened during that vaccine, or what happened during that situation, to kind of determine what might have caused you to feel so ill.
It's important to kind of
think about the flu vaccine and make sure that we're dispelling those myths associated with the flu vaccine, and make sure that we're clear that generally a very safe vaccine, not something where we see people having very severe illness for a week like you describe, or very severe symptoms. So I think it would be important that you're having that discussion with your physician to sort of clarify what caused those symptoms and clarify that you should be a good candidate to get the flu vaccine this year. But I will reiterate that generally a very safe vaccine that we don't see those sort of symptoms from.
Thank you. I want to share with you our poll results are in from the last question. The question was, has this conversation today persuaded you to take a flu vaccine if you had not taken one as of today? And 58% of you said yes, you were persuaded to take the flu vaccine. 42% said no. So let's return to questions. Our time is winding down, and we want to try to get these questions in. Dr. Edwards-Johnson, I'm going to share this question with you from Ms. Williamston. Ms. Williamston, are you prepared to announce your question?
Yes. Yes.
Go ahead.
Okay, my question is I have several autoimmune illnesses, and I fell and was in quite a bit of pain and really debated whether I should go to the ER or not, and then we felt we had to because of the COVID. I was concerned with my autoimmune illnesses whether I was putting myself at more risk. Well, I went to the ER with my husband, and I told him I was autoimmune suppressed, and they didn't have any rooms. It was a busy night. So I was put in the hallway where ambulances came through, and people, some were wearing masks and some were not. I didn't feel safe with that, and we again said that I was autoimmune. Did they have at least a bed that wasn't where the entrance was, where people came in on ambulances? They did not. Would it have been good looking back on that? I mean, I didn't get the COVID, and I'm very grateful for that, but I was hospitalized. So should we have gotten into our car and tried getting to the other ER, rather than staying there like that? I mean, I was wearing a mask, but I know mask protects others, but it probably did protect me somewhat too. But it took when you're this sick myself, I didn't want to get sicker by getting the COVID. So what would you recommend? I have the flu shot. I keep up on those things and so forth, and I do everything I can to keep well, and we're doing what they say. But when you have to go to the ER and you have a situation like that, would you recommend people just getting back into the car and trying the other hospital and seeing if it's better, and if it's not, just stay and hope you don't get it?
Okay, well, thank you. We're going to let Dr. Edwards-Johnson respond. Thank you for your question.
Thank you for your question. I appreciate you sharing that story with us. I think it kind of gives us an example of how complicated this can be and what people are dealing with when they need to go to the ER, and they may be dealing with an immunocompromised disease or illness. I certainly agree that you have to keep yourself as safe as possible. And so I think it makes sense where you can, if you can, to wait in your car. There are a lot of institutions that are allowing that, and they have some sort of way that they can call you to let you know that you can come in. If you are in an emergent situation, you should go to the nearest ER, and we are seeing that that is the most important piece. If you have an emergency, you need to go to your nearest ER. If you have the opportunity beforehand to have some insight about what ERs or hospitals or urgent cares in your area are doing to keep people safe, I think doing that ahead of time can be helpful. Having a sense of where you can go, where you're going to feel comfortable, where you will be protected. Generally, the institutions around us have been very good about making sure all hospital personnel are wearing masks and that patients all have masks to wear. And that has significantly decreased the burden of disease, particularly of COVID, in our hospitals. But certainly doing what you can to keep yourself safe. And I think the strategy that you suggested around staying in your car, maybe not going to a different institution, but seeing if you could stay in your car until you need to come into the hospital. I worry about people traveling to different institutions when they've had an emergent situation happen and, leaving a hospital. So I definitely recommend getting a sense of the institutions around you and what practices that they're using, and then, asking if you can stay in an area where you'll be more safe. And then, of course, washing your hands and wearing masks.
Yeah, and I would also add that you can always, in advance, you can always call in and let them know of your condition. You can tell them that you have autoimmune disease, you're immunocompromised, and you would not like to wait in the hallways, and you would be like to wheeled into the room, in your private room, as soon as possible.
Thank you. Dr. Chopra, I'm going to share this call with you. This is Latanya from Flint. Latanya, can you ask your question, please?
Very quickly, it may have been answered. I take a flu shot every year with my physical. My physical is not until December. Should I get the flu shot early, or should I just wait the full year?
Thank you, Latanya, for your question. I think you should get the flu shot now. You should not wait until December because, as you know, flu can be a serious disease, particularly in certain high-risk patients. And any flu infection can carry a risk of serious complications and hospitalization. So it is very important to get, as per CDC, this is the right time to get the flu vaccine. I would not wait for December.
Dr. Edwards, we have another call. I'm sorry, Dr. Chopra, we have another call that you might want to respond to from Flint, from Shirley. Shirley, can you ask your call? Ask your question, please.
Thank you. I want to thank you for taking my call, and I appreciate what AARP is doing in providing this program. While I was listening to your program this morning, for the first time I learned that there is shots for people of older ages. I will be 85 next month. So while I was listening to your program, I took the phone and called my doctor's office and asked the flu shot that you gave me last week, what kind was it? Because I've just learned that there is one for people of my particular age. She knew nothing of such a flu shot. She said the one you received was just a regular flu shot, and if anything else became available, you would not be eligible to get it since you've already had that one. So my question is, perhaps you may be aware of something that my doctor's office is not, that might be helpful to me in my situation, or do I just have to settle for the regular flu shot that I've forgotten and just hope that it'll be sufficient?
Yeah, that's a
Thank
great
you.
question.
Go ahead, Dr.
Thank
Chopra.
you.
I'm sorry.
Sure. Thank you for your question, Shirley. I think that mostly physicians are aware of the high-dose flu vaccine. It's called the Flu Zone High-Dose Seasonal Influenza Vaccine. And it's been around for a while now, and it covers, it gives you a higher antibody response for older adults more than 65 years of age and older. The only time it is not recommended is if there is some severe allergic reaction to the vaccine. But other than that, for